We get heaps of people that come through the door because they've had back pain, and that tends to be one of the most debilitating type of pains that people can get is back pain. Most of the time, there's so many different structures in the back that you need to be aware of. So, just in terms of normal back structure, you've obviously got the bones and the spine, you've got discs between those, you've got the joints which join the spine itself together, you've obviously got the spinal cord passing through the spinal canal, and you've got the nerves that come out through the back. So, just in terms of the spinal column, the nerve roots, the discs within that vertebral structure, there's a heap going on there. On top of all that, you've got ligaments that support the back and support the structure. So the joints are joined by ligaments. You've got ligaments that sit in front and behind the actual vertebra as well. And then on top of that, layers on things like the muscle and deeper muscles that might move the joints in small ranges, and you've got the bigger muscle which obviously if they're in spasm, that creates a lot more compression. So in terms of back pain, it makes it really hard to just have a global look at what's going on, and have a global structure that fits everybody. Um, what we do get asked a lot is, what do I do if my back's sore? What do I do if, should I use heat or should I use ice? In terms of first line defenses, obviously, if you've got an acute back pain and you're concerned, if you're a back pain sufferer, you probably know what works for you. You know to rest, you know to sit down. Modern thinking is that you shouldn't be going to bed for 2, 4, 6 weeks and resting and then trying to move afterwards. You want to give your body 24, 48 hours and then start to try and move, unless you've got raging things that you're really concerned about. So the big sort of red flags that we're looking at if somebody comes in is, do you have pain that's just local in the back, or is it radiating out of you towards across your bum? Are your sort of bum cheeks involved? Are you getting pain that goes down the legs? Are you getting pain that sort of goes as far past the knee or down to your toes? And in terms of that, that means that there's something causing pressure, or there's something irritating, or there's some inflammation. We don't actually know what it is, but there's something at the top that's causing those referred symptoms. So obviously, if it's quite local in the spine, that's not so severe. If you're getting pain that's going down towards your baby toe, then obviously something's causing a lot of pressure higher up that's going down towards the toe. The other thing that we're looking at is, do you get any pins and needles? Do you have any numbness? Do you get any feeling of weakness in the legs? Can you feel your feet? Can you feel your legs? And that's really trying to signify what the difference is in the muscles that are the nerves that have been affected. So obviously we get nerves for touch, we get hot, we get cold, we have pins and needles, we have light touch, sort of heavy touch as well. And also in terms of the pain and the way that it tracks down, it can track in a different pattern or position. So what we're looking at is, if you're sore at the top of the spine, does that correlate down where you're getting those symptoms down through the leg? And the big thing that we also want to be aware of is, has your bladder and bowel been affected? Do you find you've got some numbness in that sort of saddle area? Do you have any sort of pins and needles in that area? Because again, that can point to a little bit of compression in the nerves around that area. And certainly if you're having trouble toileting, so if you're finding that you can't go to the toilet, or you're having trouble passing when you do go to the toilet, that's something you do need to mention, because again, you've got tiny little nerves in the base of your spine, and they're the ones that sort of look after that area. And if you're getting numbness in that area, that's something you need to tell someone straight away. One of the other big things is, if you cough and sneeze, and if you are coughing or sneezing, does it cause pressure in the back? And sometimes that's quite a good indicator of a disc issue. If you cough, you're sort of pinching the disc and it gets quite uncomfortable. So again, what we're looking for is, are you trying to support yourself? Are you trying to give yourself a bit of room on one side? And that just means that you're trying to open up that area, and give it a little bit more space. So if you've got discs and joints stacked on top of one another and there's a bit of fluid here, you're going to want to open that. So if this bit here is dodgy, you're going to want to open and lean away. So that's what we're looking for when you come in. Are you leaning away one way, or are you leaning away the other way, just to try and get some gapping? Um, but yeah, if you've got back pain and you've had back pain for a long time and it is normal for you, you generally will know what your back feels like, and you generally will know, what you do when it's sore, what's your go-to things when you're sore. If you find that you're getting pins and needles in that saddle area, you're getting pins and needles and things that are running down your legs, and you finding that you've got some weakness in your legs, or that you're tripping over your legs, that's definitely something you want to be telling somebody about straight away. So you need to be ringing your doctor, and letting them know straight away that that's an issue. um, Hot and cold, what would you put on? To be honest, it does come down to personal preference. If you've got back pain, there's some people that swear by ice and they love the ice on the back. I generally tend to use heat, even if it's quite acute. I don't tend to think, and that's my personal opinion, I don't tend to think that, the joints and the structures and the discs are so superficial that putting heat on it can cause a problem. But obviously, for some people, it might. So if you've got a lot of muscle spasm, ice and heat work well. I will still generally plump for heat, but again, that's because I hate cold. I don't like being cold whatsoever. So I can't think of anything worse than putting ice on. But I'll generally give the client or the preference that they prefer. But in terms of your actual big, thick back muscles, like your big strap muscles down your back, I don't think that's too superficial, that putting heat on there is going to be an issue unless you have specifically damaged that muscle, and that's the caveat in there. If you've actually pulled and strained that muscle and you feel that you've got a muscle injury, you definitely don't want to put heat on that. But if it's just your standard back pain, that might help. um, be aware of what you've been doing as well. If you can normally struggle day to day, and or you get by day to day and it's not such a big deal, and then you've been out over the weekend in the garden, or you've done a hike around the shops, or it's coming up to Christmas and everyone's going crazy with Christmas shopping, and trolleys are getting carted left, right and centre, and wheels are wonky, and you're doing a lot more than you would normally do, then you might find that you're in a little bit more pain than norm. If your normal strategies don't work within sort of 24, 48 hours and you can't get some relief, that's when it would be worthwhile seeing somebody and getting some relief. We tend to have a lot of success with people with back pain, um, certainly in our clinic, but a lot of that is due to the education and advice. So if you've had back pain for years, you generally know what will make it worse. You generally will know what helps you. And what we then do, layering on top of that, is giving you strategies that help speed that process up. So if you get sore after sitting for 10 minutes, we know it's a loading problem. We can work with you to try and reduce the stress and give you some support so you can sit longer. But also, if for any reason your back pain gets sore again, instead of it taking 2 weeks or 3 weeks to get over, hopefully you get over it within 2 to 5 days. And that's what you're looking at with a management strategy. What you're looking at is that it takes quicker for your episodes of pain to resolve, but also that your episodes of pain are spread further apart. So if you're finding that you're back sore 2 weeks of every month, what we're hoping for is that you may be back sore for 1 week of every 2 months. So you're not maybe getting rid of pain completely, but what you're able to do is manage it. So if you've been pain free for a while and normally you have an episode and it floors you for 2 weeks, then it takes another 2 weeks for you to get back into the normal swing of things. Hopefully it only floors you for a couple of days and you're back to normal within 4 days, and it's not as bad. So it's looking at what your current situation is, what your normal history of pain is, and what your normal sort of strategy management is, and then just streamlining that. So if A happens, I do this. If B happens, I do this. If C happens, I do this. It's not like you've got a catalogue of 20 things that you just go, okay, I'll try number one, I'll try number two, I'll try number three, maybe number 10 works. What you've got is problem A's come about, I use point B to help. Problem C's come about, I do this to help, so that you then have the tools in your toolbox to manage what's going on quickly. And this was triggered by one of our clients who came in today, who we've seen probably for a few years on and off. Hopefully you get better quick. But normally, if if she has a flare up, she walks over and she walks in doubled over. And, she's obviously in a whole world of pain, and things get, stressful. You can't sit, you can't walk, you can't move. But hopefully she improves within a couple of days. Hopefully, she gets upright and she's able to move quickly, rather than finding that she's doubled over, and then it takes her a week to get central, and then it takes her another week to get moving. Hopefully we're at the point now where we go, yep, we know what's going on, we can do this, we can do that, she can go home and do her own stuff and hopefully improve. So I'll let you know if that worked later on. But yeah, that's what low manage or that's what long-term management of pain should be about. It should be that you are able to space out when you get episodes of pain, so that you're pain free or able to move and function well for longer periods of time before your pain comes on. But also, when you get the pain, you know what to do straight away. You don't have to sit around and wait for a week for it to settle before you improve. You don't need to wait for a week, because you've got some stuff you can do at home. And it might be, I need to get in and get treatment, because I know if I get X, Y, and Z done quickly, I get my back pain and I'm back to work in 2 days, rather than I'll wait at home for a week and then I'll look for some treatment. And then 3 weeks down the track, you're only sort of, halfway to where you want to be. So it's very individualized. A lot of it can be what works for you and what doesn't. It does take a little bit of working with clients to find out what their triggers are, and you generally will know your triggers. You just don't realize you know your triggers. And you generally will tell us what you do to get better. You just don't recognize that that's what you do to get better. So if you're in a whole heap of back pain, and you know that you get back pain, have a think on your worst days. What do you do? If you have the worst back pain at the moment, what would you do to help it? What is it that helps you? Do more of that. If you know that there's certain things you avoid because you know it triggers your back pain, what are those? Avoid those and have a think what it is. And there might be a bit of a common theme. And the other thing to look at in terms of what helps you is, if you know you're sore, what do you do? Do heaps more of that, and do heaps less of what it is that triggers you. And then you should find that just naturally throughout your day, without even coming into us full management, you're starting to think about what hurts you and what helps you. And that is a long way to managing, because if you don't recognize what hurts you and what helps you, then you're not going to get anywhere along the track to improving yourself. And what we're all here for is to improve ourselves. So if we know we've got a cut on our finger and we just keep picking it, and then we go, yeah, I should stop picking that, but then we keep picking it, we know that it's going to take longer and longer to heal. And if we know, actually, every time I pick it, it bleeds, I'm going to put a plaster on it to stop me picking it, then you've got a plaster on it, so you've got something to take off before you pick it. It stops you and prevents you from doing that. So have a think about your worsening factors and do less of those. Have a think of what is your helping factors and do more of those. And if you want any tips specifically for back pain, like I said, heat and ice tend to be interchangeable. It depends what you prefer, and they both have an effect on muscle of pain relief, and they both have an effect on muscle of relaxation as well, and helping with spasm. The only thing would be if you put heat on something that's inflamed and swollen. So if you're putting heat specifically on something that is inflamed and swollen, that's not great. You would prefer to put ice on that. But yeah, have a think if you are in chronic long-term back pain or pain in any area that's ongoing, and just think about what you do day to day that triggers it and what you can do day to day that helps it, and then start recognizing those factors and acting on those factors. And that is stage one in how to manage yourself better. All right. If you would like anything else on back pain, there's a whole heap of things we have got. We'll go with that, and we'll be back tomorrow.